This is about addiction to drugs or substances or behaviors that might be detrimental to your health and your well-being. Someone asked me the question, how do you know someone is making progress in their addiction or their recovery from addiction? If someone had been using some very tough, strong drug and they are chronically addicted to such substances for quite some time, if you were able to stop using heroin or cocaine or meth, but now they are smoking marijuana, that should be progress. That should be progress. It is impossible for someone to stop using or indulging in certain behavior for a period of time so long and then to be able to drop it and stop at zero and don't do it no more. It's impossible. It's very difficult. Of course, there have been cases where people stopped smoking, and then when they were told one day, after many years of smoking, that this could kill them because they have lung disease or whatever, they were able to put the cigarette down and never smoke again. Those are very rare cases. But in most cases, people will have to be guided, supported, and then be led gradually into finding ways to cope with life stressors so that they can then use other things, substances, like maybe drinking fresh, good water, or eating good food, having good diet, going for a walk, doing, just indulging in certain activities that will help them better cope with life stressors, stress, rather than using drugs to cope. That would be my submission at this point. So someone comes to me and said the man was using cocaine heavily before, but now he's smoking marijuana. That's fine. That's fine for a while until you can guide the person gradually towards not using as much drug as they used to. And it really helps that way so that they are not overwhelmed. And that is why people who are in recovery always say one day at a time. If you're thinking about 5, 6 months down the road, might be too difficult for you to accept. But for the drug addict, if he or she can take it one day at a time, that would be a better option. And then another question people have asked me too is, why do you give one drug to help someone quit using another drug? For example, the psychiatrist downstairs below my office prescribes Suboxone. We use Suboxone just like methadone, but Suboxone is better than methadone to help people detox from heroin or opioid. And this is important to note that we're giving them what we call it a harm reduction. Harm reduction in the sense that we're giving them Suboxone or Subutex or buprenorphine to help them detox from opioid. That, in a way, instead of them chasing the high all the time, looking for opioid, they will take a drug that will help to calm down the craving and help them learn new ways of coping with life. And that is CBT also, CBT, cognitive behavioral therapy, which is a way of we're trying to lessen the damage. We're trying to cool down the brain with the detox medication, buprenorphine, Suboxone or Subutex, or it could be methadone too, while the person is learning to manage their life properly, so they are not constantly chasing the medication or the drug. All right? Good luck.